So welcome everyone to Thursday night yoga therapy, and tonight we're working with the lower back again. And this time we're going to move more into stretching the QL a bit more from a different direction through rotated twists, and we're also going to do back arches to strengthen the back and stretch the psoas. So I've had a request for psoas, so we're going to draw that in. So just lying down, and just arriving. You've had a busy day. Then you can bend your legs. You can have your feet wide, knees in. Let's just do some belly breathing. Inhale into the belly. And exhale, making a ha sound. Just keep this going your own timing just to arrive. If you like, you can make this a humming sound. Just notice how that lengthens your exhale. Tonight we're in this third chakra area of the belly button. So one hand on that spot, and then bringing the other hand to the heart. That's where we're moving next week, to the upper back. You might want to put a block under that other elbow that's up. And in this position, can you breathe into the chest and then into the belly? And exhale, draw the belly in and the chest falls. Inhale into the chest, into the belly. Exhale, draw the belly in, the chest falls. Inhale, chest, then belly. Exhale, belly in, chest falls. If it's comfortable, bring both hands to your heart. And maybe chanting Om here. Om. And perhaps bringing one hand to the belly and the other to the chest. Just see what that feels like. So as you Om, draw the belly in, and then just see if you can feel any sensation in the heart as well. Om. Switch hands. Om. Last time. Let's try stretching your legs out or keeping them bent. Notice what your lower back prefers. It's a bit more of a back arch. So your lower back, you might be able to put your hand in that little space between your lower back and the floor. And just as you exhale, just draw your belly button in towards your spine and see if you can press down onto that hand. And then inhale, release. The other hand could be on your chest. Exhale from the pelvic floor up to the belly button, or it might just be better just to focus on drawing the belly in towards the spine. Sometimes that's a little easier. Keep that going. Now, if you can remove that hand and put it on your belly, can you exhale and try to draw the lower back all the way down to the floor by drawing the belly in? See, you might have one part of your lower back that gets to the floor and the other doesn't, especially if you have scoliosis. So just notice that. See if you can really feel your lower back moving to the floor as you exhale. And as you inhale, can you breathe into the chest, then the belly? Exhale, belly in, pelvic floor all the way to the belly button, all the way to the lower back, going to the floor. And inhale into the chest and the belly. And exhale, pelvic floor all the way to your belly button. And release. Now we're going to try to keep that breathing going. Chest to belly. So I'm trying to get into the full back arch that includes the chest. Inhale, arms coming up, breathing into the chest, then the belly. And feel the lower back moving even more away from the floor. Just feeling that back arch. And exhale. If this is hurting your lower back for whatever reason, it doesn't like to arch, you can decrease the arch by bending your knees and angling your knees in. So that's a choice. If this is not enough, you can put a block, one of these soft blocks I have, or a pillow underneath your pelvis. So just keep this going and modify as you need to for your lower back. So every lower back is different. Just feel what yours prefers tonight. And what is true tonight might not be true next week. So this is the interesting thing about living in a body. It's feels a little bit more changeable than the cars we drive around in or our bicycles. They also change, but our bodies are quite changeable. Maybe adding a hold after inhale. What would that feel like, to feel that back arch a bit more, holding after inhale and exhale? Inhale from the top to the bottom, from the chest to the belly. Exhale from the belly to the chest. Every time you exhale, can you bring the lower back to the floor? Every time you inhale, can you feel your lower back moving away from the floor and even your chest? If you have that hold after inhale, it's for energizing. Okay, let's bend the knees. We're going to do the same thing now, but lifting up our pelvis. And we are going to use the arms today as we move a little bit more into the chest. Last few weeks, we've been all in the lower body. It's the last 5 weeks. And now we're just going to start adding a little bit of the chest. Linking the chest to the lower back. And tucking the chin in at the top of the inhale, maybe holding after inhale, 3 to 5 seconds. And exhale, coming down. Can you count your breath? Inhale, 4 to maybe 6 or even 8 seconds. Hold after inhale, maybe half the length of your inhale. And then exhale, coming down. When you're staying in the pose, try to really lift your pelvis up, lift your hips up, because your glutes will tend to not work. So try to think of lifting a little bit higher than you might like to by using those glutes. Don't let the lower back sag. You could have a block between your legs if you prefer for more stability of the pelvis. Dvipadipedam. It's very simple. And adding that hold after inhale anytime you like. And your last one may be staying in the pose. So when you stay, bring your arms down. Maybe tuck your shoulders underneath. Maybe bring your hands to the sky. Press down on your elbows, lift a little higher, then hands resting on your belly, around that belly button area. And try to inhale into your chest and into your belly, and exhale, pelvic floor, lower belly, belly button in. The chest will fall just a little bit. You'll come down a bit. See if you can lift any higher. And when you're ready, release down. Notice how you feel. Okay, so I'm going to invite you to grab your bolster. We're going to work with the back arch, but targeting the psoas a bit more. So the hip flexors. Many of us have tight hip flexors. You can do this with a big pillow. You can do it with a couple of these soft blocks if you have those. Just take what you have accessible and have your belt nearby. So we're going to use that later. So take your bolster and put it underneath your hips. Could be a big pillow again, as hard as possible if you're using a pillow. And then extend one leg long. So I'm going to start with my left, and I'm going to bring my left arm up overhead. Inhale here and exhale. You can bring your hand down, and if this is hard for you, you could bring your leg in and just take a little rest. Or some of you might be able to just stay here because I've warmed up your back. Just stay here and breathe. And you just want to adjust that bolster to really comfortable in your lower back. Just make sure your lower back is nice and comfortable. If you like, as you inhale, you can point your toes, exhale, flex. Or just stay. When you're ready, you're going to switch sides. Exhale, bring the arm down, bend the knee, and you're going to switch sides. And you can point and flex the toes if you want. You're targeting the right psoas now, hip flexor. After doing that 4 to 6 times, just going to bend both legs, and then you're going to bring both legs out and just see what that feels like. If this is too much, you could have your feet right at the wall for a bit more support. But I'm going to move my legs, so I'm not going to do that. You can bend one leg at a time instead, okay? So you can just stay here. If you're staying here, you could tie your ankles together. You could have your feet at the wall. I'm going to do a vinyasa with the arms. So inhale, pointing the toes. Just going to move a little bit more this way. It's pointing the toes, and then exhale, flexing the heels, toes towards the nose as I bring the arms down. So that's just helping me integrate my breath. And you can add that hold after inhale if you want. So this is a version of Setu Bandhasana. And just finishing up. Hopefully your back feels okay. You're going to bring your legs up to the sky. You're going to exhale, just bring your feet towards your face. Inhale, legs to the sky. Exhale, feet towards your face. This is moving towards Viparita Karani with a bolster. Simple inversion. We're doing this to stretch our lower back in the opposite direction. It's quite a deep stretch. And we're going to move to one leg at a time. We'll add the belt in a minute, but first we're just going to work more with core strength and stretching that psoas again. So you're going to bring one leg down. Just notice the stretch in that hip flexor. If it's too much, you can bend the knee. So I've got my right leg down, my left leg is up. I'm just going to stay your breath. Now, if you want to work on more core strength, keep that lower leg hovering above the mat. And on your next exhale, bring it up and use your core strength to bring it up, and your feet slightly back towards your face. Inhale, other leg. My left leg is coming down, and maybe I'll hover it above the ground or rest it. Just see which you prefer. Deeper stretch when you kind of let it go, actually. And then start to exhale and bring it up using your pelvic floor to move your leg all the way to the belly button, just going side to side. So we're stretching the psoas, we're arching the back. And I did some of this when we worked with the hips. We're bringing it back to work with the lower back because the hips and lower back are very linked. And working with the core strength. So the whole lower body from the belly button down is working now, all the way to the feet. Now you might consider staying on one side and breathing. So I'm going to show that now. So I'm bringing my right leg down, my left leg to the sky. I'm going to put a belt on my left foot. I'm going to make that loop big. I'm just stretching that leg. Exhale, bend the knee. Inhale, straighten. We're going to switch sides. So it's working the whole lower body from the waist down. Exhale, bend the knee. Inhale, straighten. And bringing both legs up, bringing both feet towards you. You can get rid of the belt or use the belt if you need it. And this is almost like plow pose, halasana. Just bring your feet a little bit back, keeping your pelvis on the bolster. So you could think of it as Viparita Karani or Viparita Karani moving towards halasana plow. And just trying to feel that deep stretch in your lower back. You might, if it's too much, you can inhale, legs away, exhale towards you as we did before. Or maybe you stay in the pose. Again, you could use the belt to hold on to the feet if you want to go deeper now, or just hold on to the feet with your hands if you have that flexibility. It's like an inverted Paschimottanasana, seated forward bend. Watch your neck. Any pain in your neck, just ease off. So this is to decompress the lower back. All right. So we're going to come out of this with that bolster. And just bring your knees to your chest for a moment. Go this way so you can see me a little better, hopefully. Just with your lower back flat on the ground. Start to exhale, then start to move. Maybe stay in the pose, hugging your knees on top or underneath. Okay, we have time. So I want to move into some back strengtheners. But I want to work with the bolster under the belly. Now you could use a blanket or a pillow if this is too high. If you have a bolster and it's not working for you, just use a blanket or a pillow and putting it under the chest. So sorry, under the stomach, not under the chest, under the stomach. And just seeing about lifting that upper back away and feeling the lower back, and then exhale. So my hands are in front. This is often called Sphinx pose. You could have a prop under your forehead to land on. That feels better. Just arching that upper back and going into the lower back, and then exhale, coming down. We're going to go more into the lower back in a minute. Just want to start with this. Some people have a really hard time doing these back arches, and this can be a way to access them. We'll leave that. We're going to put the bolster away. And now, just going to target just the lower back, and then we'll put the two together. So lying on your belly, you can have that blanket under your belly if you like. You're going to tuck your toes under. You have your arms by your side. You could have a block under your forehead. You could fold your arms and rest your forehead on folded hands. You're going to inhale, straighten your legs. Your knees are off the ground. Your toes are tucked under, and exhale, release the knees down. Just keep that going. Inhale, straighten. This is also really strengthening for the legs, hamstrings, the quads, the glutes, and exhale, release. And we're going to take it a little deeper now. You're going to lift one leg up. So I'm going to lift up my left as I keep my right toes tucked under. I'm going to keep my forehead down for now. So it's all lower back. Exhale, and other side. Inhale, extend. Exhale. Now you can do this classically with just keeping one foot on the ground as well, Ardha Shalabhasana. But I like the toes tucked under because it just makes you work a little harder and keep a bit more engaged on the opposite side. So it gives a bit more stability to the pose. Now this is feeling really good. I'm going to play with adding some arms. I'm going to start with them bent, and I've got my hands under my forehead for this, actually, not by my sides. So you're going to inhale. You're going to bring your left leg up and your left hand up. For this one, don't have your hands on top of each other, just have your fingertips touching. Inhale up with a salute, and exhale down. Other side, right leg, right hand. Now, if that's feeling easy for you, you can move to a diamond shape. One arm at a time. And if that's feeling easy, move to long arms in front of you. Now you can start playing with this, whatever you're doing with your arms. You can do opposite arm to leg. You can also unplug those toes and try it just that way. Ardha Shalabhasana. This one is great. If you have scoliosis or other misalignments of the spine. It's working opposite upper back to lower back. Kind of our sub-theme tonight is linking the heart to the power center in the gut. Let's see if you're feeling your lower back at all. And if you want, you can try both arms and legs, whatever you're doing with your arms, keep the same arms, depends on your neck. Inhale, both coming up, full Shalabhasana, exhale, both coming down. All right, so I hope you're doing okay. We're going to take a little break. We're going to come into child's pose or lying your back, face to chest. You can have your knees together or apart. You could also take your bolster and put it between your legs. Do this with a pillow, you can do it with a blanket. Come forward. And I personally like to hug my bolster and do it that way. There are many versions of this. You can have blocks under where my arms are right now to lift up. You can have a little block under your head or fold your arms for your forehead. Play with where your legs are, your knees. You can make them more apart. You can angle your feet out, get more into the hips. Be careful with that one. I'm not going to do that. Just rest here. It's really great to bring the floor up to you through a bolster or a blanket, even if you don't have a full bolster, to bring the floor up to your lower back, and that lengthens your lower back versus when you let your belly sag, your lower back is sagging to the floor with it. So this is supporting your lower back in a different kind of way. You might feel that. Just rest here. And slow down your breathing. You have your head turned, turn it the other way. When you feel ready, we're going to go back onto our back. So you're all able to do child's pose. If you're doing this later and child's pose isn't working for your knees, you can lie on your back. And I'm just going to show that for a minute, just so you remember this. This is the modification. is this position of the wall, okay? So just remember that in case child's pose is not working for you. All right, so we're gonna move into our twists. So make sure you've got lots of room. I'm gonna move my blocks and everything aside a little bit so I've got lots of room. You don't need a belt or anything. Now, if you, that said, you might need a block or a bolster to bring your leg to when you twist. So keep that around in case you need it. You might need as much as a bolster. So, find your pose. In here, enough room for your arms to go to the side in a T. So just find that. And we're just going to start off small. So just starting with windshield wipers, inhale center, exhale coming to one side, inhale center, exhale the other side, just keeping that going as we move into our rotated twists. Notice how your lower back feels. So my lower back always gets a little bit tender when I do big back arches because my lower back doesn't particularly like back arches. My back likes forward bends, and some backs like forward bends and some like back arches. So note that in yourself, because that was my first lesson of yoga therapy with lower back pain, was start where the person is at and move the back in the opposite direction. And that has proven true even when I work with someone who's fractured their pelvis or other such injuries. So it's pretty simple, but very effective. So you want to move towards that direction. It's not comfortable because you want both ranges of motion through the back. Okay, so these twists are kind of in between. Getting into the outside of the hips and the back. We're going to cross one leg over the other and do that. So I'm just starting with the right knee over the left. Center, exhale, other side. So this is hips, and now moving more into the lower back. When I go to the left, the right knee over. And the opposite shoulder. So if the opposite shoulder is coming off the ground a lot, just don't bring your knees down as far. And when you're ready, switching sides. All this is also very good for digestion. We've just heated ourselves up with back arches, and now we're twisting out all those toxins of mind and body through these rotated twists. So this is a great practice for constipation of mind body, is that kind of approach. Heat everything up and then twist it out. Great for anxiety and fear, a similar approach. Lots of back arches and for bends or twists. Just now with the left knee over the right, I'm feeling more the lower back when I come to the right. Just finishing up. And take it the next step, you're going to bring your knees to your chest. You keep your legs bent to begin. Now you could have a block on each side as a landing pad. So bring your knees into your chest like you would for Apanasana. And you're going to bring your knees over to one side. You don't have to bring them all the way. This is also core work, especially if you don't go all the way. It really works your core. But I'm hoping to stretch your lower back, so I'm going to go down all the way. So that's your exhale. Inhale here. Now I want you to exhale all the way over to the other side. So we're only going to move on exhale just to make it a little bit safer. Inhale, stay, and feel your lower back stretch. Inhale. and then exhale to the other side. Now you might want to have the palms down, which is classical for this, to give you a bit more support. Might want to put your hand on that top thigh to get a bit deeper as you stay here. On your next exhale, going to the other side. Stay in one breath. And when you're ready, exhaling to the other side. Start to exhale before you start to move. You're probably like me, creeping down your mat towards your feet. And just finishing up your last round. Coming back to the center and make yourself more in the center of your mat because you're probably crept down a bit. And just notice how your lower back feels. So for me, that always fixes the back arch, all the back arches. When I do that, my back says, okay, I'm okay now. A little tender, but I'm okay. So we're going to take this further now. And we have time. Time is on our side. So we're going to bring the hips over. I'm going to show actually on the other side more classically with the left first. Have that block nearby in case you need it. So you're going to shift your hips over to the right. Bring your hips over to the left. So the pose we were just in, that's the first step. Now your next step might be stretching the top leg. That might feel good for you. Or perhaps you want to stretch that bottom leg. Now that bottom leg could remain somewhat bent. That might feel better for your back. So just explore that a bit. Stretching it, bending it, what feels better, check in. Maybe you want to take a block or a bolster and put it under that knee, that right knee, so that your right shoulder stays down. And some of you will feel a big stretch in that right lower back, especially those of you who have concavity in your scoliosis on that side. I'm finding I'm getting more out of it having my lower leg bent tonight, which is interesting. So it's not my usual experience. So every day is different. Just play with that. That bottom leg straight versus bent. Can you add a hold after exhale? So draw from the pelvic floor up to the belly button, draw it in and up and hold after exhale. Can you draw that top hip down as you do that? Inhale from the chest to the belly. Exhale from the pelvic floor all the way to the chest. And hold after exhale. And one more. And switching sides, just very lazily. You're going to come back to the center. There is a fancy vinyasa that we can do, but I like to, in a yoga therapy sense, just be very slow and mindful. Come out of it, see how you're feeling. Switch your hips to the other side, to the left. Bring your knees to the right. Decide whether you want that block underneath your lower leg, or a bolster or a pillow, or even between the legs. We didn't talk about that. Some backs prefer that. You could just stay there. You could stretch your top leg. You can even hold your big toes. You want to stretch into that IT band area a bit and drop the hip. That's more your focus. Or you want to go more into the lower back. Stretch that bottom leg. And again, maybe adding that block under the knee or a bolster or pillow, trying to keep that left shoulder down. Some of you will be able to turn your head towards the left. You want to turn the top of your head right and then turn from there. I can't do very much of that because of my neck, but if you can, that's the classical. Jatra Parivriti. Full classical pose is holding the big toes in this. It takes it more into the hip, I find, when I add this piece. Could be using a belt. So I'm going to keep it bent so it keeps more in my lower back. Adding your hold after exhale when you're ready. Hold after exhale about half the length of your exhale. Inhale, chest to belly, exhale, belly to chest. Hold after exhale. Bottom leg can be bent or straight. See what gives you the best effect on your lower back or your hip. Come back to the center when you're ready. Notice how you feel. Feet wide, angle those knees in, just rest for a moment. Counter pose. I'm going to do happy baby. So you can do this just holding under the thighs with your hands. So I know all of you can do that. Some of you will hold the calves. Could have two belts that you hold the feet with, or some of you will be able to hold the little toe side of the foot. You could also hold the big toe if you can get that little toe side coming down, which is a little harder usually when you're holding the big toes, but it is possible. I personally like holding the little toe side because I can really decompress my spine there. And inhale, maybe some of you will stretch the legs wherever you are. Exhale, bend, so holding under the thighs. I know all of you could do that for sure. Or some of you will be able to hold the feet, either big toes or little toe side. Could have two belts, one on each foot to do this as well. Maybe staying in that happy baby pose. Feel your spine decompress. So my teacher Sridhar gave this to me in my last practice. They don't call it happy baby pose in Chennai. It's just a version of Urdhva Prasrita or Supta Padangustasana, holding the big toes and then bending. But it is a wonderful pose, and my teacher said this is a very good pose for your lower back. So hopefully you can feel that. And when you're ready, you're going to rest. In Shavasana, I invite you to put a bolster under your legs or pillow, or you could join me by putting your feet at the wall. Just see what you prefer. One of the things I like about this version, rather than just letting my legs splay out, which is classical, is that it really keeps my pelvis aligned and I can feel everything. If you have any tenderness in your lower back, do put something under your thighs. Just resting here. Feeling the bottoms of your feet. Feeling your calves sinking into the floor. Feeling your thighs. And your hamstrings sinking into the floor. Feel the weight of your pelvis, your hips sinking into the floor. In your lower back. Again, if it's feeling tender, bend your knees or put something under your thighs. Just notice how it's feeling. Everything really worked. In your middle back, sinking into the floor. Your upper back, sinking into the floor. The weight of your shoulders, your arms, your hands, sinking to the floor. You feel from the chest down to the feet, including your arms, as you exhale. Sinking into the floor. Let's do that again. Inhale. And exhale, let it all sink into the floor. Let's move to the back, the neck. Asking it to relax. Feel that space underneath your neck. Feel the weight of your head sinking into the floor. Now feel the top of the head. Imagine there's water running down from the top of your head, down your front body, from your forehead, your eyes, your cheeks, your mouth, your throat, your chest, your stomach, your pelvis, your thighs, your knees, shins, your ankles, your feet, your toes, breast. Starting to cut back into your body, increasing the length of your breath, perhaps bringing your arms into it, stretching them overhead. And when you're ready, bending one knee at a time, rolling onto your right side. Stay here for a moment. Coming up to a seated position. And together, or you can stay lying down if sitting is not an option. Shanti, Shanti, Shanti. Hari Om.
Namaste. Namaskaram.